I'm Peggy Peck, MedPage Today, reporting from the American Stroke Association International Stroke Conference in San Diego. Time is brain, as was well illustrated during discussion of the golden hour here.
Looking at the golden hour patients, the patients who arrive within the first hour after the onset of stroke symptoms, because as you know, time is brain in acute stroke, and every minute counts. We know that every minute in which a patient is not treated, 2 million nerve cells die. We know that every 10 minutes in which the only approved drug for use in acute stroke, tPA, which is approved only to be given in the first 3 hours, every 10 minutes in which its delivery is delayed, one less patient benefits from treatment. The analysis that we did found that there is a large number of patients who are getting to the hospital quickly during this time frame. That there were over 30,000 patients who arrived within the first 60 minutes at hospital who are having an ischemic stroke, and once they've done their bit by getting to the hospital soon, they are advantaged. They are more likely to be treated with the drug with substantial proven benefit, tPA, and to be treated earlier with that drug. There's a natural tendency when a patient gets to the hospital early for physicians to say, we now have some extra time. We can learn in more detail about the nature of the stroke and make a little bit of a more considered and deliberate decision. And unfortunately, deliberation time comes at the expense of brain in acute stroke.
It is, however, not just the golden hour that occurs before the patient arrives at the hospital. It is the platinum hour after they walk in the door, the time from door to needle that is of concern.
That drug in your hand has a 6.4% risk of causing harm in terms of hemorrhage into the brain, which either kills you or makes you worse. 6.4%, 1 in 17. So 1 in 17 times you say go. Even if you're doing it right, these patients are suffering injury from that drug. Now, it's still the right thing to do, don't get me wrong. That will give you pause. You will think about this for a minute. And what we can't do is we cannot pause. And that's the hard part.
The American College of Emergency Physicians, American Academy of Neurology, and the ASA, the leading emergency physician in neurology and patient groups in the U.S., recommend educating patients that tPA, when given correctly, improves the final outcome among 100 treated patients in about 32 patients, and worsens the final outcome in 3 patients. So it's a very net beneficial benefit to harm ratio, but there is a harm element, and that makes it everybody want to do it right, and that makes everyone want to slow down, and there's a natural tendency, therefore, to want to deliberate. And we have to achieve the right balance in the right patient to make the right decision as fast as possible.
And so, the issue is time. Time from symptom onset, time from door to needle. Time is brain. In San Diego, at the American Stroke Association, I'm Peggy Peck, MedPage Today.